Assalamu alaikum viewers. Faheem, Malik, Mohsan Qureshi, and Shamoon Ali, they are with me today. Especially our programs called Mindset. Used to Mohsan Qureshi's do it on a regular basis. Due to his activities now these days, he's quite busy with his work, so mainly hardly doing any videos. But thanks for him to coming down and actually bringing the issue, which is actually the vaccine about COVID-19. We had all kind of different speculations, especially within the Asian community, and because of that, a lot of people are actually very wary to take that vaccine. And Mohsen has some experience on that, and I think Mohsen, you might as well talk about that. And Shamoon, if we got any questions comes in my mind, we'll talk about it. Go on, Mohsen. Now to you.
First, apologies. I haven't been doing regular mindset programs. I'm humbled by the feedback, and a lot of people I come across are always asking. But yeah, now it's a good time, and we know we're living in certain times. There's a lot going on. There's a lot of things which are unclear every day, every week. Things are changing, whether it's the tier system or whether it's a vaccination or people's health and concerns. And day to day, we're having more and more challenges. And one of the reasons we wanted to do the mindset program was so we can give clarity, we can try to educate people. And from speaking to a dear brother of mine, he's the head of business and operations in Birmingham, and they work for the health services, and they are working firsthand and some of the first people to come across the vaccine. So what I wanted to do was, in the beginning, give a different perspective, which a lot of people probably don't know and see, but this is direct from the source, from the front line. Like I said, he's head of the business and operations. And what he was explaining to me is that they have 10 different areas or districts within Birmingham which they cover. And the affluent areas, which are predominantly white, when it comes to them making the phone calls for people to come and take the vaccine, the uptake has been quite high. Some of the challenges, though, unfortunately, which he's faced is when it comes to the other areas, which are more densely populated by our Asian people. And again, firsthand, some experiences he told me was, as he's contacting them, there seems to be a lot of misinformation they have. There seems to be a lot of speculation. Some of the things is where the elders may be saying things like, oh, if I get COVID, it's Allah Marzi. And some of the youth who are answering the phone on behalf of their parents, they're turning around and saying, we don't want to take the vaccine, stop bringing our home. It's lined with monkey DNA. It's got a microchip in it and some other stuff like that as well. And the reason I wanted to talk about it today is because, again, our audience is the British Asians, but again, it's the over 80s which are beginning to take the vaccines. Then it'll go to the over 75s, people who are frontline workers. And in previous shows, we've spoke about our culture and the positives of our culture, and we have a duty upon our elders. So people from my age group, the vaccine isn't going to come to me. If it does, it might be in a year, 2 years' time. Even if I do catch it, I'm more likely to survive it. But the thing is, with our elder generation, whether it's our parents or our grandparents, if they were to get something like COVID, they could potentially die from it. So now a potential solution has been made. A vaccine is out there. The calls are going to these households, but there seems to be a lot of backlash. So it's our job to maybe try and educate a bit, to give people a different perspective. And it's one of them, we also have a responsibility, because God forbid tomorrow something does happen while the solution's been there. The youth who are taking the phone calls on behalf of the parents are going to have to take some responsibility for this as well. I'm not sure if it's similar in Canada, Shamoon, anything you're witnessing from your end within the Asian communities, but it's something I wanted to dig into today.
Well, yeah, no, there are some concerns that have been roaming around through internet and through friends and family, people sending WhatsApp messages. Even I received one message, one of my family relatives, close relatives, very not like some ordinary family. They are people that understand things, that comprehend things. Yet they sent me a message saying that the message actually included a video from someone that claimed to be a doctor, wearing the white lab coat, everything, right? And claims to be doctor in relevant field of medicine, saying and claiming that the vaccine being designed is to insert microchips in your system that would allow them to control you,
Mhm.
right? And I received that video and I right away dismissed it. Now,
Yeah.
question is why I dismissed the video. There's doctor there. She's giving her credentials and she's giving the situation that, this vaccines are not good for us. For
Yeah.
the COVID-19 vaccine is not good for us and how we would be controlled. But I only in response asked one question, which was that there is not one single vaccine being developed.
100%.
So, which vaccine are you talking about,
Yeah.
right? And
But
I think you had some numbers of how many
yeah.
vaccines are being developed right now.
So currently there's 270, that's 270 different vaccines in development. Some
Hmm.
are at an early stage, some are at, they've had previous funds where they've just ended up trying to adapt to suit the COVID-19 so it can target it. And I think this is one of the things that I wanted to try and clarify today. A lot of people are concerned, how have they managed to develop something so quick? So first of all, there are 270. It is a global effort. It's not just one person or one team or one group of scientists. It is globally. Everyone is chipping in and trying to do the best thing to try and find the right solution. I know now in England, we were one of the first ones to trial it out. The Pfizer one, it's going out. It's doing well. I've spoke firsthand, and I know from the person who's working on the front line in Birmingham that he's taken it. His family, who have got elderly and also of health conditions, have taken it. He said to me, my arm was sore for a day or two, felt a bit lethargic here and there, but in terms of long term, there's been no problems, no issues, and anything like that. So, from one perspective, they're like, it's a no brainer. We've got a solution here and something to help. It is tested. Within the UK, there are lots of regulations. It has to go through tests. People also volunteer to test, and I've seen videos that they wanted to try and do their part for their country and their community. And they've gone out there to take the test during the processes and to ensure that when it does get rolled out, it's safe. There's another one, which is the Oxford one, which I believe is close to being finalised, and that
Hmm.
has other elements to it. So again, it's adapted. The process of when it comes out of the fridge and they dilute it, the lifespan is quicker and longer. So it's a constant process. And one
Yeah.
way I've tried to explain it to a lot of people, just to give it in different terms, and it might help our viewers also, is we've come a long way in terms of science and technology. If I was to give a deadline and say within 1 week, I want a supercar to be made, and everyone can join forces and all the big manufacturers and the design teams can work together on it, are you telling me with everything that they've done, they're not going to be able to achieve that? Because
Hmm.
again, they have templates, they've been there and done it. It's not the first time they've come across something like this. We're in better positions, there's more support out there, and people are willing to work together. So again, I get it, it's a common thing that people are asking the question, but there's always two ways of looking at it.
Yeah. I completely agree with you. There is also we have to keep in mind that this is not per se our first rodeo, right?
Yeah.
What I mean to say by that it's not first time that the world is facing a situation where there is a rampant disease that can expand anywhere in the world, right? So in the past, because of these factors, there were checks and balances that were started to be put in place in the event such an event happens, which
Yeah.
is why there was possibility of creating a vaccine much faster. People are starting to compare it with, oh, there is no AIDS vaccine, or there is no this vaccine, there is no that vaccine. No two diseases are alike, right?
Mhm.
It's the matter of what kind of disease is it and what part of the body it's affecting, right?
Yeah.
And in this case, we are talking about something that is flu or malaria related kind of disease, right? It has similar, uh, what's it called, line of action as flu.
Yeah.
So the flu vaccines in the past and malaria vaccines, and there were other vaccines, as we have heard in the news and in channels, that they're using those existing vaccines in
Mhm.
order to further the development. And this is also the reason why it was able to develop faster,
Yeah.
right? And in terms of questioning, you just mentioned it's God's will,
Yeah.
right? There are a lot of things God's will. If
Yeah.
you're going to leave it on God's will, why don't you just sit at home and not work? If it's God's will, you will get paid and you'll have food.
Exactly.
Why do you get
Exactly.
up to eat? Why do you go to work? If it's
Yeah.
God's will, you will get everything. So you
Yeah.
can't just leave it on God's will, right? God helps those that help themselves.
Hundred
So we
percent.
can't just leave it at that.
Yeah, yeah, yeah. But just to
I,
add to your point, Shamoon, sorry, Fame,
I,
just to add to Shamoon's point, it's we've also been given a freedom of choice by God. We know what is wrong, we know what is right. If you have been given the ability and the mind to go out there and find solutions, you should. And if God has been the one to put COVID out there, he's also been one to give the intelligence to people to find solutions also, and the vaccines potentially one of them solutions. And you made a brilliant point. It's just that this is why I wanted to speak about it, because there's loads of information out there, but there's also loads of misinformation. And if
Mm,
our elders, we know they're not educated, they can't use the technology the best, they can't go and do the research and go onto the government websites where everything is there for them. If they're just going to be showing certain bits of social media which may not ring true, again, I've rarely looked at the videos because for the way I like to think is I'm going to go direct to the source. I'm going to speak to a professional who has a lot more knowledge on this than me. I'm going to speak to a specialist. Not any random person can now pick up a phone and realize how to work a camera, and they want 2 minutes of fame and they're just talking utter rubbish. But unfortunately, people tend to believe that because we're in such uncertain times. We're in times that people don't know where they're coming, where they're going, or what's going on. They're quicker and easier to be influenced by these type of things. So we have to be
mm,
mindful that we've got that duty towards our elders to explain to them that, yeah, there may be some concerns. There's nothing wrong with asking questions. We all should, because we're all going through it. Something like, oh, it's first time in our lifetimes we're facing something like this. It's not clear, but there's a process in place. So it's like I
I,
said, sorry, Fame, go ahead. Go ahead.
no problem. No, because I've been listening to both of you guys. Actually, the bigger concern is the a lot of Asian Muslim, because I know loads of them, and they have all kind of speculations, theories, especially the mosques. They are actually majority of mullahs, I can say. They always saying things like this, which is really have a big impact on, Mohsen, you mentioned, Allah di Mazi, you go in Bradford, you go in Birmingham, you go into London, wherever the Asian communities are, they're still into the bigger confusion. This is actually no such disease, is all done by West and everything else. And a lot of people who actually, when they get ill with the COVID-19, which is, I know a
Yeah.
lot of people's right, okay, then they realize it. So what I'm really saying, because the whole purpose of you guys to do that discussion, the Asian community to understand, I can say, is a big Maulana Tariq Jamil. He's been positive COVID-19. There's a lot of people follow him. He really said, "You be careful and obviously get treated," uh, because somehow a lot of our peoples, whoever has kind of a Muslim faith, they're getting into confusion of a lot of mullahs saying a lot of different things. To me, COVID-19 is existing, COVID-19 is
Mhm.
happening, right? So you guys, rather than looking into speculations, and if some of our children's who actually listening to all this speculation, because you guys know, we are social media ourselves. Social
Mhm.
media is the tool is affecting a lot of people. Basically, like you, Shamoon, you mentioned certain video. There was a nurse. I mean, I can show the quality is not very good. The nurse who actually take the vaccine, and then what happened? She get fainted, and 8 million people watched, trying to explain. Look, this COVID-19 vaccine is not very good. But then after another video she made and explained she has another medical condition, because of the other medical condition, right? She
Mhm.
fainted, not because of anything else. Saying at the same time, everybody, as in human body, some have a bit more resistance, some has a less resistance, some has different problems in their life. Sometimes any medicine, never mind COVID-19 medicine, any medicines you take, sometimes you can have a reaction. I mean, there's a lot of speculation out there. People were saying anybody who come out of COVID-19 Like if they've been diagnosed and after 14 days they recover and they get treated, they take, some of them might be talking about taking the medicine. After that, the stomach upset, right? It can be very, very small numbers, but if somebody's got a stomach upset, people are saying it can be any other reason, not because of the COVID-19, but people have that speculation. People
Mhm.
like me quite worried about things like this because there was so much speculation. And to me, I took the measure. I can tell you from my point of view, I took the measure. I made sure I do, like wearing mask, staying home, not socializing too much. I am quite active and a socialized person, but I really stop myself to make sure nothing happens to me, and plus my family, my wife, my mother, people around me. So basically, I've been telling everybody, even if you have any kind of speculation, just make sure, don't think it's not out there, you're gonna get it. And there's a lot.
Mhm.
I know one of my friends, close friend of mine, he came down and he was sitting with me in the studio talking. He says, oh, we Muslim, we pray 5 times, we wash our hands, we clean ourselves, I'm not gonna get it. So I says, sir, I think you'll be cautious, right? But after 2 days, if he's found COVID-19, like he was positive, right? And then 15 days, and then when he does it, I get worried because he saw me 2 days before. But what happened? Luckily, so far, touch wood, I am actually diabetic. I also take blood pressure tablets, but I'm so far lucky. And what I am really trying to say here, in anybody who lives in UK, never mind speculation or not, COVID-19 is out there,
Yeah.
uh, and medicine, you have to take it. Mm, Anybody who lives in UK, if he's, doesn't matter how many speculation he does, initially, if you live in UK, you're gonna take it by
Mhm.
hook or by crook,
Yeah.
because if you don't take it, they can put measures on it. Say, for example, yeah, they found if you don't take the vaccine, you'll be dangerous to the public. They won't let you go to work. They won't let
Mhm.
you travel into bus. They don't let you travel into out the country. They don't
Yeah.
let you do that because they really wants to protect people out there. So doing all this speculation initially, anybody who lives in UK, you have to take it. I
Mhm.
know there's a lot of people stereotype, nobody can force me and things like this. But there's a lot of people who's taken the COVID-19, the vaccine. It's up out there. I just heard today it's nearly 10 million arriving, and they're gonna start from 4th of January again. New Year's they're gonna start in UK. I don't know about the Canada, but what I'm really saying to everybody, stop the speculations is there. And if you live in UK, you're going to take it. So never mind confusing, making difficulty for your elders, because some of people's like Mohsen mentioned, or Shamoon, you guys, you are fitter than me. I'm diabetic, you probably get the medicine down the line, might be 1 year's time. But if somebody's elderly, I seen women cross the road to my house. I actually took her to take the vaccine from the surgery. So she's perfectly all right. I mean, I've seen her, it's nearly 10 days now. Nothing happens to her. This just lived right across the road to me. So
Mhm.
it's one of them things, you got to take it. And that's what I'm saying. Most of you can come into
Yeah.
that.
So you mentioned a few points. I'll try to dip in and cover them all. From the beginning, it was in regards to the masjids, and even the masjids, to be fair, whenever I've been going, they've been following whatever the rules and regulations are. When we go into a mosque to pray, we have a separate bag we have to put our shoes in. We have to bring our own masala or prayer mat for our non-Punjabi speaking viewers. We are socially distanced. All the prayer mats are lined 2 meters apart, and we are not to shake hands, to hug. There's sanitizers upon coming in. We go in a one-way system. A temperature gets checked. We leave out through a different door. So everyone in this world, in this country especially, to operate, even when I go to work, we've got rules and regulations which we have had to follow. People may disagree, people may not like it, but we have to understand it's not about me. It's not about what my opinion is. And even what we're speaking today, we're not here speaking our opinion. It's about the bigger picture. And the bigger picture is It's about everyone's safety. And in order for the numbers to decrease, and in order for everyone's health and well-being, we have to do these things. It's simple people thinking, oh, this, that, and the other. But again, it's not necessarily about you or what your agenda is. And we're like myself, I'll go to work. If something happens to me, I'm not concerned at all. But I have families at home. I have friends who I come across, people who may have underlying health conditions that I'm not aware of. And I don't want it to be a case that I'm the one who's carrying it and passing it on to someone else. So we all have a duty of care and we all have a responsibility. And just to add, and there's some comments coming through as well, and thank you everyone for your comments. Again, just to add, Aruj is agreeing that we do have rules we have to follow. There was a comment before, what if I don't have it? Do I need to take the vaccine? Again, just to add on to Faheem's point, right now, as it's come into a country, it is for the 80-year-old and above. Then when more vaccines arrive, it'll be 75 plus, people who are frontline workers, people with underlying health conditions. And again, like you said, Faheem, it might be a year, it might be 2 years until it reaches people like ourselves or of our age. But it's similar to when you travel to other countries. If you want to go to Saudi Arabia, I've spoken to people who went to do Umrah and Hajj, and they had to take certain injections in order for them to enter the country. If this is a global pandemic, if you want to fly to Dubai, to Pakistan, where a lot of our people like to go, if them countries were to put the measure in place that until you do not have this vaccine, you are not allowed to enter, unfortunately, that's what we're going to have to do. I just want to add a bit, which is maybe stopping people from wanting to get a vaccine. And again, it's still the early stages. In a year's time, in 2 years' time, we don't know what position the world is going to be in. We don't know what position we're going to be in. But many times there are logical reasons behind these. And I know a lot of the concern is about a microchip. I know my knowledge is minimal. I don't think it's possible for someone to put a microchip in a liquid, first of all. And secondly, if people are that concerned, there's something like this, which everyone has. If you're that concerned about being tracked, we all have social media, you're doing it to yourself. If you're going in every place and uploading it and tagging yourself, I'm in here and I'm in there, there's no need for a microchip. You're doing it yourself on your own phone.
Exactly.
It's true. There's so many people who are so concerned.
Well, I completely agree with you. Just on that point that someone that was asking, I think Ms. Sundar Shahid was asking previously that if I don't have the COVID-19, why do I need the vaccine? You need the vaccine because vaccine is to prevent you from having it. That's the purpose of the vaccine. So obviously you do need it, right? There was another comment. Now different people have different reaction to it. Some people that get sick for a long time. Some people recover. Some people, and there have been people in my immediate family that I have seen that have gotten the test positive and they had no symptoms, right? Some people got sick for a little bit, but they got better despite of having medical issues, despite of having sugar, this, that. And some people got really badly sick, and after even recovering, they had issues, despite of being young and athletic and this and that. So we cannot just blanketly say that only certain people, certain group of people is going to get affected by it, right? So I just wanted to clarify that. Secondly, we have to keep in mind sometimes it's not visible that you have it. The symptoms are not easily distinguishable, right? And sometimes you have no symptoms. You can be asymptomatic and still have it. So obviously you're not going to keep testing yourself. So what about that? Thirdly, there was a comment here earlier where someone was talking about that my neighbor was fine until she got the vaccine, but she got the vaccine and then she got sick. And which is where that video of the doctor, the nurse was very important. Look, if someone got sick and you assumed that, oh, they took COVID vaccine, that's why they probably got sick, they were fine before. How do you know they were fine before? How do you know they got sick because of the COVID vaccine? How do you know that they may have taken the vaccine and they may have picked up a habit that was not their habit before and now it's their habit, so which was a negative habit which caused them to become sick, right? You cannot just directly link the vaccine with being sick without connecting the dots properly. You know, there is a scientific method to do it. I'm not qualified to give that scientific method. And your neighbor is not going to be qualified to do that most likely, unless your neighbor is specifically in medical infectious diseases field, researching and analyzing this. So
Just
do not
to,
just take people's word.
yeah, just to chip in also, Shamoon, like, again, we're not here to promote anything, nor are we here to say, do this and don't do that. Everyone is going to do what they think is best for them. We just understand that it is a concerning time. It is a worrying time. It is for everyone. We're all in the same boat. We're all going through a
Yeah.
new life experience together globally. And
No,
we've got people from
the
all over
reason
the world here.
the
And
reason I'm saying it this way is because
yeah,
it does personally bother me when people are reacting in this way, that they're jumping to conclusions.
100%.
That video again was people jumping to conclusion. 8 million people watched the video of the nurse passing out after the vaccine. So they assume that she passed out,
That's what's happened, yeah.
right? And then 1 million, only 1 million. So only like small number compared to 8 million.
How many? Yeah, no.
8 times more people watched it.
Well, one thing
And
I would advise is, Shamoon, what you're saying, I agree. Like, we shouldn't be quick to just jump to conclusions and assume this is this and this is that, because there's enough concern and worry as it is, and people are automatically trying to find answers, and they could be getting these answers wrong. But based on something that Faheem said earlier, what I would urge people is, if you think it doesn't exist, speak to people. I know people firsthand who have had it. I have seen some of the some of the symptoms they had. Some people really bad cough, couldn't breathe. Some people, their whole family got ill, had to stay inside. And I have recently had a discussion with someone where they thought, oh, there's no such thing. And luckily there was another friend of mine sat there, and he says, what you on about? Nearly my whole family had it. And it is a real thing, and it is there. And if you think it doesn't exist, go and speak to them people, because some people actually thought the angel of death is coming for them right now, because that's how bad they felt. So when somebody is in that position and in that situation, and there's a country and a government that's trying to provide you a solution, are you telling me that person's not going to take it? It's all well and fine us being sat here well and healthy, shukr alhamdulillah, with not a problem and a concern in terms of our health right now. But tomorrow our circumstances could change. None of us are invincible. If tomorrow I was in the position where I've got it, it's a respiratory disease. If I can't breathe and I'm struggling and a week's gone by and I'm not getting any better, if somebody was to say there's a vaccine here, it's free, and it's going to help you get better, or it's going to prevent you from getting into that position in the first place, that's a mindset people need to have, that there's something there which can prevent you. Just because we haven't seen it with our own eyes or we haven't felt it ourselves physically doesn't mean it doesn't exist. I'd urge people, if they're not sure, go and do your own research. Do your own research. There's plenty of people out there. If you are getting calls from these professionals because your elders need to come and take the vaccine, ask them some questions. They're the ones with the knowledge. They are the experts. That's how I like to operate. I'm going to go to a source who knows more than me, who can educate me, not look at a video on social media of God knows who, and just believe everything they say.
Like, your research has to be quality research as well. Like, for example, when you write something in a university paper, right, and you're preparing a document, essay or something in university paper, you only go through the credible resources to write in it, right? So you wouldn't just write whatever. You wouldn't just write, oh, I saw this on YouTube video. You'll actually go to scholarly articles, right? Same way when you're doing research for this. Don't just look at the videos on YouTube. Don't even believe our video. I'm not even saying that, oh, just watch this video and we will give you perfect information. You gotta go out and figure out exactly what's going on based on the professional advice from qualified, registered doctors, right?
100%.
And base it on those things. Don't just listen to the neighbor. Don't just listen to the person like me sitting on TV, on the YouTube, right?
Yeah, like us.
So,
it's all right. I mean, what I'm listening to you guys, I'm just going to bring what I'm trying to do. You can read some of these guys' message. At least they are actually outside there. They are actually, some is agreeing to us, some is had a little bit speculation. So might as well you read some of their messages and try to really, our views can see people's have, some people's agreeing to it, some people's have a little speculation. So if you want to read, give this message.
so Zainab Nisa, what she just commented Uh, I can tell you from the North American perspective that Joe Biden, the president-elect of United States, has already said on record that they are not going to make the vaccine as prerequisite of some sort. They're not going to enforce it. It's going to be a choice. So just to answer that comment.
Mhm.
Right.
But with the sorry, Fane,
Can
with
I?
the
Can I?
UK,
Right.
yeah, yeah,
Okay.
of course, good.
I seen in social media, there's a lot of people who actually doesn't want to lock down themselves. A lot of people in Denmark, they actually made a rally. They didn't want to take the vaccines because they're really thinking there's a lot of ifs and buts about it. But reality is, there's a lot of people who really get very seriously ill. There's a thousands and a thousands people died in every country. So people saying, like, I can't convince you, Shamoon. You have your own mind. But something we call a common sense, something in there. People who saying you can't touch us, it'll happen. I'm just giving you two examples. Two close friend of mine. One is in Bradford Royal Infirmary, Qazi Waisab. He was very Islamic, and he says, like a lot of Islamic people, they say, oh, God help us and everything else. And like I have a speculation, and I still have, try to avoid not to go to hospital. The only reason is, to me, I'm thinking the hospital environment, it might be bit more dangerous because all kind of a patients goes in there. So that's really in back of my mind. But saying that, I'm still very cautious, make sure there's nothing happened to me. Initially, when it comes to taking it, I will take it because I'm actually diabetic and everything else. So speculation goes totally out of the window. What I'm trying to do, save ourselves, right? What I'm trying to give message here, mention two people's. It's one of my friend, is Professor Saab, right? He was always shopping about it, and he's thinking nothing going to happen to him, and his whole family found positive. Touchwood, they are perfectly all right. I mean, some people's immune systems, like Shamoon mentioned, you probably have a COVID and your own immune system killed it, right? But that doesn't mean COVID is not existing. So even the COVID is changing kind of a shape, is all they were saying from the beginning. When it's COVID-19 come, it'll be COVID-20. Initially, if any disease will really change their shape and things like this. So to me, before you really get something very dangerously done to you, your family, your loved one, to help with these speculations, when you get a chance, take it, because safety matters. Nobody is going to make me zombie. I don't think so. Nobody else going to make zombie. This whole world, this, the Microsoft ideology they're talking about, this, all that, this is all to me, right? If they're going to force it, if you're living in the UK, you're going to have it. Either you like it or you don't like it.
Yeah,
So rest of this speculation, they're not going to do anything like that. It's common sense. Like you remember 5G things, people's talking about the all the layers, and there was a lot of hoo-ha. Where is it gone now? Not existing. And 5G is getting used by loads of countries now, and we can't see any sign of that. So it's just like you find odd people who are doing things like this.
you
Uh,
know, yeah. Fine. With some things, time will tell. Right now, it's still the early stages. Right now, it's one of them things that it's a process. We have to let the process take place. We can't automatically discount something or assume because it hasn't been out long enough, because it's been made too quick, because I saw this person and they weren't feeling well after it, that, like Shamoon said, it's a blanket approach. Everyone thinks differently. Everyone acts differently. I've probably got 100 things wrong with me, but because in my mind I think I'm all right, I'm all right. It comes down to a person's own perspective, doesn't it? And just to add, in terms of control, since the COVID's happened, since there's been lockdown, my life hasn't actually been very much different. Everyone's in fear of the people are trying to control us and the vaccine's going to control us and whatever else have you. I've still been going to work. If I fancy going to a takeaway every night, I can still do it. If I want to see friends or family over the holiday period, I've still been able to do it. My life hasn't been that much different. All I've had to do is adapt, and I've happily adapted and put measures in place for my safety and more so for the safety of others. Because if I'm not concerned what's going to happen to me, Again, I don't want to pass it on to someone else or bring something else. So if that means at work, wear a visor or a mask, I'll do it. If that means when entering a store, put a mask on and sanitizer, I'll do it. Nobody's asking anybody to jump off a bridge or run a million miles. It is basic things that we've been asked to do. If someone's come back from a different country, you isolate. Not because you want to, because of the greater good for everyone else. And I'm just reading Aliyar Mirza, Salam Aliyar. We need to get rid of these people who are spreading negativity. We need real information and advice from the professionals. Why would I take advice from a chef about a medication defeats the purpose? And I agree with him 100%. The source of information, like I've said before, is very important. We live in an era where information is so easy to find, but as equal as that, misinformation is also so easy to find. But again, the number one thing is we have a duty of care. We have a responsibility. Nobody can stop me from doing what I want. And to be honest, since the pandemic started, nobody has. I've still gone to work. I've adapted. And I might have said in a previous program, one of my favorite boxers, Floyd Mayweather, I don't like him for his personality, but I like him for his skill and his mentality. And every time he was in the ring, he said, you have to be able to learn to adapt. He didn't used to watch videos of his opponent, but while he's in there, he's assessing it and he's making adjustments. That is all we've had to do, which is make adjustments. Tomorrow, in a year's down the line, if they say anyone working in a school, you have to take it, I'm going to take it. If they say anyone who wants to travel abroad, you have to take it, we're going to take it. Life isn't going to stop. There's been previous illnesses, viruses over the centuries. People regularly, every year, take a flu jab. People go to Saudi Arabia, you take vaccinations before you go. It's a common thing. Give it a 2 years' time, it's probably going to be similar like Faheem was saying with the 5G. It's not going to be a massive conspiracy anymore. Some things, it just takes time. And I think in people's minds, they're making it into something bigger than it actually is. Yes, it is uncertain. It is worrying. Not only that, everything that's taking place, but we just have to go through it. We can't sit around moaning and complaining and thinking, I'm not going to do this and I'm not going to do that. I'm sorry, but it's not all about you. It's about everyone.
That's right. Shamoon, you want to say something on that?
Yeah, I was gonna say that just wanted to use a little bit of my personal example, right? Like in Canada, you can get flu vaccines, right? It's free. You can go get it right before the flu season. And there are people that are called anti-vaxxers that are against flu vaccine. They don't get it done. They don't give their kids the vaccine, and that's what they believe, that it's not useful for them, or it's negative for them, right? My personal perspective, I'll tell you, like, I have been someone that has taken vaccine at times for flu, and have been someone that has not taken for some years the vaccine for flu. The years that I didn't take it, I didn't have time or whatever, or sometimes I justified that, look, I'm going to take the vaccine, I'm going to be sick for 2 days. While there's a possibility that I might not get sick at all this season because I might not catch flu.
Mm-hmm.
So pros and cons, what are the chances of me getting the, vaccine, and what are the chances of me getting the flu in this season?
Yeah.
What kind of activities I will be involved in? You know what, this year I don't need to take it, right? So that's kind of like decision factor for me that I was using. Now, coming to the COVID vaccine, we're discussing the actual issue that we're discussing is not understanding the information that's coming out. It's not that we're trying to convince people that they must take vaccine, or we're trying to convince people that they must be against the vaccine. The information is fresh. New information is coming out every day. We need to keep our eyes out. When it comes time for us to qualify to take the vaccine, that's when we make sure what is the data that's given to us up till now, and is the vaccine safe enough for us to take based on the qualified resources of information, and then decide to take it or not to take it. That's like,
I
we don't
think
have to make up our mind right this moment, but if we just go like, again, the blanket idea that, what, don't take it, it's bad.
Shamoon, what you're mentioning is pretty much standard, and everybody should really do that. But somehow, this people's like Mohsen mentioned in Birmingham, People are not really taking it. Even the
That is
children,
a concern for himself. That's a concern.
right? So
It's the
basically,
Asian ones are the least ones who are turning out. It's only been going on for 2 weeks.
them guys, look, mm, you can really putting your elderly dangerous. You might be
Mm.
fit. Your elderly might not have anything, right? But you make sure don't even just really look. This is any kind of a conspiracy. This is what I really wants to. There's a lot of people throwing the questions. Do you want to read that again? So
Yeah, so it's Alayar again, our brother. People are very quick to point out and gossip. We have real lives at risk and we really need to take this serious. And I think it's just adding to the point you're saying, Fame, that is, Jesus, so so much going on in now. It's not something like, oh, I've seen this video. Sorry, mum, you're not getting anything which might help you. We don't know. These are things which are calculated. These are things which experts are actually going through. There's a process behind it all. And we don't understand these processes. That's why the experts are doing it. We're just the people who are at the end. And if we're
well,
being advised to do something for our benefit,
one point I want to make. You remember literally 5 6 months ago when they were talking about 5G, right?
yeah,
And that time we're all talking about it because it's viral in the social media, right? And initially we're asking all the friends, whoever we know, we had all kind of videos on social media, all kind of experts sitting talking about it, right? Okay. Initially it's died down. Now nobody's talk about 5G.
yeah,
People are kind of expecting it now. Now COVID-19, when it comes, a lot of people saying this is bull crap and all that things happen. That this is bullshit, is all conspiracy and the
mm,
all the things. Now there's a thousands and thousands of people died in UK, all over the
mm,
world, people dying. So I am telling everybody who are actually watching it, just look at that. Don't go into the speculation. The people who died, the people who already take the vaccines, the people who already actually gone through with it. So they're okay. I mean, I'm just giving
fine.
men.
If I can just chip in, I'm going to go slightly off topic here, but it's very relevant to what we're speaking about. So we have many people from our generation, maybe younger, who are the ones answering the calls, who are the ones with more access to online, with information, misinformation, whatever it may be. There's something here which has been put out there. Yes, it's early stages, time will tell. So no one's saying we know the answers, we don't. We're taking it as it comes, just like everyone else is. But day to day, even within our Asian communities, especially around the areas we live in, there are people who put all sorts into their body. People will take alcohol, people will take drugs. I was driving just the other day and I saw a lad having a balloon, which they get these little gas canisters and get high off helium or whatever it is. When people are putting all these things in their system, nobody gives two F's about it. When it comes to something like this, these exact same people all of a sudden know everything about everything. So when it's an intoxication, our people happily put it inside their bodies. They'll happily damage their own body, damage their own brain. Fair point or not, I can see you smirking, Fame, because it's true. We have many people within our communities, within our cultures, they'll even be watching this, they'll have all sorts, and they're not going to question it twice. What is this that I'm smoking? It's probably more harmful than that vaccine you're putting in your body. So if we're going to come across with this mentality, be consistent about it. If you're that concerned, become a major athlete, control your diet, even the food you eat. Our people, we've done a program before, the food we eat, we don't even monitor that. But we're also concerned about a vaccine. If you're going to do it, be consistent, live a healthy lifestyle all around, and you won't need to take this vaccine. You won't catch
Yeah.
COVID because not only are you not
You
abusing your body, but it's true. These same people.
you're bringing in very good point there, because see, the thing is, I think, like, if I look at it, it's part of it is that we are standing up against the system, or the man, standing up against the man, like the governments are bad, the organizations are bad, right? That's what we think. So whatever information they're giving or whatever, oh, there is some conspiracy, they
Yeah,
must be trying to control us.
yeah,
I
yeah.
mean, they don't benefit or get
Nothing.
re-elected per se if we are not happy with them. So they're if they shove the vaccine down our throats, you
Yeah,
know, on based on some fake disease that we don't believe in, we won't vote for them. So what's the benefit for them?
yeah, yeah.
Like, I mean, people come up with all sorts of theories. Reality is that it is a serious issue. It is
Mm,
real. People have gotten sick. People have died. Would the vaccine work? We have vaccines that have been tested 95% positive for helping the people that were taking it. There have been tests that have proven that they're good, but all the testing is not done. Like the testing is not done on pregnant females. So the vaccine is not so far recommended for pregnant females. But again, it's certain vaccines, right? The storage of vaccines, different vaccines have
Yeah.
different storage, right? Why do I know this? I don't know everything. I'm trying to research on it, find out because I'm concerned. But again, like that's what we gotta do. That's what we are into right now.
Yeah. And even with the whole pandemic that's going on, if people who have got underlying health conditions, to just go back to my other point, if you're healthy, if you're not taking alcohol or drugs, if your diet is decent, if you're exercising regularly, you're less likely to catch COVID. If you are, you're going to recover quite quick. Likewise, even with the vaccine, the side effects for you are going to be very minimal. And this is what frustrates me. And even when I was speaking to my brother, who's been at the front line, who knows firsthand, who's been facing these challenges from our communities, that people are answering the phone and saying, there's monkey DNA in it. And I'm laughing over the phone thinking, do you think we're all going to just be bandering and climbing trees and eating bananas? It makes no sense where they've got this theory from. But that same person, not
Well,
to
by
judge,
the way,
is probably getting
if it
stoned
has
every
monkey
night.
DNA in it, maybe I would become like a monkey man or something,
Yeah.
like Spider-Man. Why not? Let's try
Yeah.
that.
Yeah, exactly. Superhuman. So this is what makes it laughable to me. The people who are sat around who have got time to look into all these conspiracies are the ones smoking something on a night. And it's like, you're not concerned when you're putting something into your body then, are you? So you have a blanket approach. If I want to live this lifestyle, I'm less likely to get it, but we still have a duty of care towards everyone else. Just because I might be less likely to get it doesn't mean I'm not concerned about the well-being of my family, my friends, the people I interact with every day. It's a sense of responsibility. It's not all about me, myself, and I. And I think that's what we have to understand, that we are all in it together, and
Uh,
it takes everyone to do their part.
can I just, because we have last 5 7 minutes, I'm just taking the funny side of it. We'll try to conclude that the funny side of it. Now, if there is a monkey DNA, Shamoon will definitely take it. He's really got excited over it, right? Okay, so
Well, why not? Maybe I can climb trees and jump
Yeah.
around the places, and it would be good.
Yeah.
right, okay. You can imagine Shamoon's fantasy. What can you do? Right. So, coming to the serious note, basically, I put you guys give a message through to the peoples one by one, if you don't mind.
Yeah. Do you want me to go first, Shamoon?
Go on, whoever.
Yeah. It's just to summarize again, like, nobody has all the answers. It is a process. It is going to take time. It is early stages. It's been a couple of weeks since the vaccine has been rolled out in the UK. And like I said, I spoke to a brother who's been leading this campaign as part of his job, and he's taken it. His elderly parents have taken it. And the concern has been the fact that the areas which has the higher Asians in it are the ones which has the least people attending. And we have to understand that we've got a duty of care towards our parents. Our parents are dear to us. We want to make sure nothing happens. So I get it. These people's intentions aren't wrong. They think I'm protecting my mum and dad by them not having this, which is totally understandable. But ultimately, everyone's going to make their own judgment. When that time comes to them to have it, again, they're going to have to make their own decision. All we're trying to say is that there's information out there, but there's also misinformation. If you're not sure, speak to the specialists, speak to the professionals, do a bit of your own research. There are things out there which you can find, and there are most likely logical solutions to it all. But the main key thing is, in this time of need, we all have a duty of care to each other. And I think it's better if we stay positive, if we stay stronger, if we try to help one another rather than misguide.
Shamoon, your time.
Yeah, I think the key thing that I want to mention here is, as I mentioned a little bit earlier too, that you will make up your mind when it comes to the time to decide what you want to do. But there is no dispute in my mind that the disease is real. COVID-19 does exist. Okay. There is no dispute in my mind that there are several vaccines coming out. What would be the pros and cons of those vaccines? What would be the effects of each individual vaccines is yet to be proven. There are certain vaccines, few of them that have been tested. on certain geographic or demographic of people, and it is considered safe for that purpose. So we have to believe on the experts. We have to believe on the information coming out from WHO, World Health Organization, right? From the qualified doctors, people like Dr. Fauci, right? We have to believe on that and rely on our decision making process based on the information coming from these people, right? But in the end, you know, if we get distracted because of information age that we are in, there is information thrown at our face, and most of it is mostly disinformation because bad information spreads faster than the good information.
Yeah.
So we have to be mindful and watchful about that. Don't just believe on whatever is coming to you or someone is sending you. Do your research, understand the facts, rely on credible sources to make your decision.
Right.
100%.
I'm just really concluding that. Thank you, both of you guys, and I hope
Thank
there's a lot of people who watching it. They might be useful for them. Uh, I'm just going to make last point. The all Western society, even the whole world, their economies are down because of the COVID-19. They're all desperately trying to find the solutions, right? No country, I'm just talking about UK, they really wants to their economy goes down that much because they really don't want to really get their peoples healthy. They are actually trying to find the solution. That's the solution is to take the vaccine. Be careful. I mean, when the time comes to you, but believe me, is out there. It might be some more diseases coming further in the life, the way things are. But protect yourself. No countries try to damage their peoples. That's for definite. Might be sometime you can say some bigger multinational, there's some pharmaceutical company try to make
you.
more bigger money. That might be existing. Obviously, this is kind of another race. But what I am really saying here, no country, as far I know, they want this COVID 19. Everybody is kind of crippled. Even the Western culture, to me, because of the COVID 19, they even lost their hegemony there because their economy is gone down. So please, everybody, protect your peoples, be careful, and forget about this speculation. If you're elderly there, they needed it, make sure they take the vaccine. We witnessed loads of them. Some people's probably very small numbers has reaction to it, but 99% or 95% people are perfectly all right. So please look after your family, look after your loved one, and don't get into the speculation. I'm in the end. Thank you very much, everybody watching.
Thank you.
Whenever we wants to give any message, whenever Mohsen is available, we'll do this mindset program whenever he's free. Obviously, it's not going to be regular, but sometime he try to put a message through. So thank you very much, everybody. Keep watching Niadin TV, the Focus TV, which is one of our YouTube things, where we can share people's. You can like and subscribe. This is Focus, Niadin, and Facebook as well. Thank you very much.